This Cincy Lifestyle Health segment, sponsored by Mercy Health.
Medical emergencies can happen unexpectedly. Thankfully, the emergency care team at Mercy Health is ready when you need them. Dr. Sara Continenza at Mercy Health Kings Mills shows us how their compassionate care team is ready to help you at a moment's notice.
Hi, I'm Sara Continenza. I'm an emergency physician here at Mercy Kings Mills. This hospital's only been open a year, so all the equipment is new and state-of-the-art to be used by the emergency department team. We can have MRI, we can have other ultrasounds done by our radiology department, CT scanners and x-rays. So we're pretty lucky and pretty spoiled by all of our nice equipment. We have the best and really everything we need to take care of patients we have. We get to meet patients from every age group, every walk of life. When people show up in the emergency department, it's typically a pretty scary day and nerve-wracking day for them, and being able to comfort them and care for them in those vulnerable moments is really rewarding, and getting to care for them when they need it most. So the triage process, it typically is done by a nurse, and the nurses are given extra training in triage in the emergency department to determine who's sick, who's critically ill, who needs to be seen first. That typically includes vital signs such as blood pressure, heart rate, oxygen level, and why the patient is here, what symptoms they're having. Are they having chest pain? Are they short of breath? Are they having abdominal pain? Are they having weakness or some speech difficulty, like stroke-like symptoms? And we will try to see the highest acuity patients first. So the patients that have unstable vital signs or complaints that are highly concerning for stroke or heart attack are prioritized. The population in this area is growing quickly, and I think we need hospitals and emergency departments to care for this growing population and the community in this area. We are constantly preparing and coming up with plans for any type of emergency, including a large-scale event, especially with such a large group of people being potentially gathered basically in our backyard. We are always thinking of plans and coming up with strategies to manage those type of situations. I think those of us in emergency medicine tend to be drawn to a little bit of the unexpected. So we like to be prepared for anything, and anything can happen, and you never know what's going to happen when you walk into your shift. We're constantly evaluating our patient volumes and how many patients we're seeing every day and adjusting to that. We actually recently just added a provider shift, so we added a nurse practitioner, a PA, onto the schedule when we have our busiest times a day, so patients aren't waiting as long during those busy times. I think when this emergency department was built, they had patient comfort and patient safety in mind. There are little things that are built into this emergency department that help patient comfort, like all the lights in all the rooms are dimmable to kind of have a custom environment to what the patient needs. The patient can control the bed height and how high their head is with their own buttons. They don't have to have someone to come in and adjust it for them. All the rooms actually have doors, which is really nice. In an emergency department, we don't always get that luxury, but here they all have doors. The way it was built and designed is really set up for patient comfort. In the time that I've worked here, I've gotten to know the nurses and the team that works here, and I'm consistently impressed by the level of compassion and kindness and empathy that they show patients and the care that they're giving.